Blood glucose monitoring is crucial for patients with diabetes to monitor their blood glucose level. The normal blood glucose level is 4 to 7 millimoles per liter. So maintaining blood glucose level within normal range helps reduce or prevent the short-term potentially life-threatening complications of hypoglycemia and the severity of long-term complications of hyperglycemia. Safety precautions need to be considered in the performance of this procedure. First, perform hand hygiene for infection control. Second, check room for additional precautions. Third, introduce self to the client. Fourth, check the client's identity using two identifiers, the name and the date of birth. Fifth, check the allergy band for allergies. Sixth, complete necessary focus assessments and monitoring of vital signs. And last one is provide patient education as necessary regarding to the management of his or her condition. So in the performance of this procedure, first, check or review the patient's medical record for diabetes type, medications, and anticoagulant therapy. Ensure that the patient does not take any anticoagulant medications to rule out the risk of bleeding after the procedure. Then, determine if the test requires a special timing, such as before or after meals. Blood glucose monitoring is usually done prior to meals and the administration of anti-diabetic medications. Gather the equipment needed for blood glucose monitoring, such as clean gloves, blood glucose meter or glucometer, reagent strips, lancet or automatic lancet device, alcohol or soap, alcohol swab or cotton wet with alcohol, and 2x2 gauze or dry cotton balls. Also, determine if the blood glucose meter or glucometer to be used needs to be calibrated. Good morning, Mom. I am Hannah, your student nurse for today. So for verification purposes, could you please state your full name and date of birth?
I am Shanda Julia E. Gando, born on July 28, 2004.
So, Mom Julia, today we will measure your blood glucose through piercing your skin with a lancet or a needle to extract a droplet of blood. Is that okay with you?
Okay.
So we will measure your blood glucose before meals. So when did you last eat?
6 a.m. in the morning.
Oh, okay. So it's been already 4 hours since it's already 10 a.m. in the morning. So we can now extract your blood. Is that okay with you?
Yes.
So provide patient privacy by closing the doors to the room and the curtains around the bed. Also perform hand hygiene and other infection control procedures for infection control. Then put on clean gloves to protect yourself from the patient's body fluids, which in this scenario is blood. Then, assess the patient's sites for skin puncture. Okay. Then, have the patients wash hands with soap and water or cleanse the puncture site with alcohol swab or cotton ball wet with alcohol, like this one. Okay. Then, assist the patient in a semi-upright position in bed or in an upright position in chair, just like this. Then, encourage the patient to keep hands warm. Then ensure that the puncture site is completely dry prior to the skin puncture. Get the reagent strip from the container. Then reseal the cap. Do not touch the test pad portion of the test strip. Then insert it to the glucometer following the manufacturer's instructions. Keep the area to be punctured in a dependent position just like this, and do not massage or mill the puncture site. Then assess if there are calluses or corns on the puncture site that will make it difficult for the lancet to pierce the skin. Then select a puncture site. Okay. Then quickly open the lancet, then pierce the skin. Wipe the first drop of blood with cotton ball or gauze. Then gently squeeze above the site to produce a large droplet of blood. And transfer it to the reagent strip following the manufacturer's instructions. Then quickly open or turn on the glucometer unless it opens automatically with the insertion of the reagent strip. Okay. Then apply a dry cotton ball on the puncture site to stop and apply pressure to stop the bleeding. Mom, can you please hold it for me? Read the results on display and note it. So your blood glucose level is 5.8. It is within normal levels. Then turn off the glucometer. Then dispose of the reagent strip, the lancet, and the cotton ball appropriately in its proper place. Remove non-sterile gloves and dispose of it properly. Perform hand hygiene and other infection control procedures. Then, review the results with the patient and provide health teaching to the management of her condition. So, ma'am, your blood glucose level is 5.8 and it is within normal levels. So, you must maintain a healthy lifestyle, such as having a balanced diet and proper exercise, proper or regular exercise every week, so that you will maintain a normal blood glucose level. Okay. Then document the procedure and the results.